When you live an active life, you're gonna experience the occasional ache and pain, right? But we wondered, what are the top injuries? So we asked Mercy Health, the largest healthcare system in Ohio, to run some numbers. Its orthopedic and sports medicine practices found the top 10 diagnoses for different age groups. From the late teens to early adulthood, sprains and strains dominated. But a surprise, at least for one doctor we met, came with middle-age injuries.
That's it.
Cathy Cann is working hard. She does physical therapy 3 times a week and home exercises to get her knee back to normal. It completely gave out earlier this year.
I couldn't step on it. Yes.
Strength still needs some work.
Turns out Cathy had what Mercy Health calls the #1 injury for its patients in her 45 to 54 age group, a tear of the medial meniscus.
You were genuinely surprised by that.
Oh yeah, definitely. You would expect some of those really common types of injuries, such as a sprain or strain, to be more common.
But they're not. The tear is tops.
The meniscus are these cartilage pads on the inside and outside of the knee.
This is one of Cathy's scans.
Like right there is where you can see the tear is.
Dr. Nicholas Early went to work on her problem. No case is the same, but for hers, they decided surgically fixing it was the best intervention.
If you're able to repair it and the patient is able to heal it, it sometimes can slow down their progression of degenerative changes significantly and really benefit them.
He says some signs you might have a meniscus issue: pain on the inside or outside of the knee, plus clicking, catching, popping, locking, or the knee just giving out, which is what happened to Cathy. And that's tough.
When you're so used to walking and having that function.
She is determined to get it back. Almost a half year removed from her surgery, her slight scars are fading.
This started out as a U, and then this is the one where he drilled the holes in my bone to reattach.
And she's well on her way there.
I think the biggest thing is do what they tell you to do. And put the work in that they ask you to put in. I think it has really paid off.
And we're certainly glad to hear that. The doc chalks up the prevalence of the torn meniscus diagnoses to increased activity levels in people playing sports longer. 2 keys to prevention: warm up before activity and keep your weight down. In the 55 to 64 age group, Mercy Health says meniscus and back problems dominate. Shoulder issues are tops for its patients ages 65 to 74. Now, we haven't talked about kids yet. Tomorrow, I'll look at the orthopedic injury most likely to take a toll on your child and how to prevent it.